Well, good afternoon, everybody. Today, of course, is May 29th, 2020. We're ending the month, and we're going to be doing our Friday 3 p.m. update, which we do Monday, Wednesdays, and Fridays. We have a lot of significant updates to give today, but I wanted to also just start just to add. I know that obviously a lot of the country right now is watching what's happening across the country. And Minneapolis especially. And I just wanted to add, I know that many of you have been struggling with the images that we're seeing on TV and reading about as well. I also want to share with you that many of you have also been reaching out and listening to the words that our chief of police has said as it regards to the incident. I'm very proud of what he has said. I also want to just add that, like many of you, I am both angered and saddened by what's happened, of course, to George Floyd. That killing was unacceptable. And I also want people to know that in Long Beach, not just for myself, but I know for all of us, our love, our prayers, our good wishes go to his family and just the entire community. It's a tragic and devastating time. It's also important for us, as I said yesterday, to speak forcefully and more forcefully about the injustices that Black Americans go through in this country. And that fight that lives within our communities and our institutions is happening across our country and community. It's certainly happening there. And we know, not just here in Long Beach, but across the entire country, within all of our cities, that we have to do better. And so our thoughts are there with that community, not just today, but every day. And with that, I want to just begin with our updates. We have several updates to give today. I want to start by saying that we have about 1,850 total positive cases. That should not be a huge surprise. These cases are going to continue to increase as we get batches from our labs, as we do more and more testing. And we try to also maximize the testing opportunities at these sites. About 1,266 people have recovered, which is good news. We want people to continue to recover, and we're hoping the best for them as well. We have our total fatalities and our deaths in Long Beach are now at 85, which is a significant number. I remember when we were reporting 15, 20 deaths, each of which is tragic for us. Of the 85, about 75% of them, 66 of them, have been from our long-term care facilities. That continues to be an area of huge concern for us. But it's also important to note that every single life, whether it's in a long-term care facility or whether it's through a community transmission, has value and really matters. And so our hearts and love and prayers go out to them as well. So let me just start by going right into the reopening process. We all know that just a few days ago, we were able to reopen places of worship, many of our churches across the city at limited capacity, of course, our retailers, as well as offices. That has been a slow process to reopen. I'm hearing from faith leaders, I'm hearing from different retailers, I'm hearing how that is going, and for most, they are taking it slow and cautious, and I appreciate that, and we appreciate that. We should be cautious as we move forward in these reopening plans. So now we turn to what the governor announced a few days ago and the city's next step. As you're probably aware, because Long Beach and the rest of LA County met the state's metrics for a more expedited track on some of these reopenings. The state of California today granted that variance for not just Long Beach, but also for the county of Los Angeles, and essentially for all 88 cities within the county, of course, of which Los Angeles is the largest. So all 88 cities are now able to reopen some additional opportunities. And in Long Beach, beginning today, we're going to be reopening in certainly a slow process, which I'm going to explain in a minute. But we're going to be reopening in-person dining rooms for our restaurants. as well as barbershops and hair salons effective today. Now, these will come with restrictions, and I want to remind folks that there are state baselines. And today's news really marks a new chapter in this reopening process, one that we should be entering incredibly cautiously. I had mentioned that Long Beach, LA County, and Pasadena entered this partnership for this variance together, and we did so at just the right time. And I want to thank the governor's office, of who we've been in close contact with throughout this process, for their support in looking and reviewing our data, so that not just our own local health officials, but the California Department of Health officials felt comfortable and confident that we had the hospital capacity, that we had the positivity percentages, that we could move forward in this area. So what does that mean for Long Beach? It means first that our new health order is now up. It will be up later today at the Long Beach website, which is longbeach.gov/COVID19. So if you are a restaurant, you are a retailer, you are a barbershop or a salon, all of the information will be available later online on how to reopen, including important checklists that you have to post at your business window. This also, just to be clear, includes salons and barbershops, but only for barbery type work, for haircuts, essentially. So as it relates to work around esthetician work, nails, massages, all the other types of work within personal care and grooming, that is yet not allowed. It's not allowed in the state of California anywhere. It's not allowed here in Long Beach or anywhere in the county. And so the only piece that has been given the green light is the actual barbery, the haircuts within salons or barbershops. And that is only piece of that. As far as restaurants are concerned, restaurants themselves have a long list of restrictions, which I think Dr. Davis is going to go through. And as a reminder, part of this is if you are a bar that has a kitchen that actually serves food, and we mean an actual kitchen approved by the health department, you can reopen the food component, the bar, the restaurant piece of the bar. The bar itself still has an enormous amount of restrictions to be able to do that safely, including, I mean, you can't really, you can't, all folks can't sit without each other. There's got to be barriers. There isn't gathering around bars that are allowed. But if there's booths in the bar, if there's a restaurant space within that bar space, there are guidelines in place that you can begin to slowly reopen. And I want to make this point, which I think is really, really important. I've been talking all week, for the last couple of weeks, with restaurant owners, bar owners, with stylists, salons. I've done Zoom calls, I've done conference calls. We've probably had conversations with 200 to 300 different businesses in these different calls in the last couple of weeks on these industries. And the one thing that I heard loud and clear, and you're going to see this weekend, is that people are going to open slowly. If you think that tomorrow every restaurant in town is going to be open and every barbershop is going to be open at full capacity, that's not going to happen. You have restaurants and these business owners. I have been encouraged at how responsible and thoughtful they're being in their reopening process. And so you will see some places start to reopen, but you will see many that may only open the patio, or that may only open for to-go, or that may wait a week or two to reopen. And so please know that that is now up to the individual business owner on what timeline they want to be put in place. Because there are a lot of restrictions to open a restaurant up correctly and to keep the employees and the customers safe. In addition to that, getting workers back and so forth takes time. And so this is going to be, like I mentioned before, not like a light switch, but like a dimmer. We're slowly going to start to reopen these businesses. And quite frankly, that is good for us and for public health, so we can manage it in a way that's slower and that goes through the process. So we support that And to all the business owners that I've talked to, thank you for that approach. It's something that we appreciate. And as a reminder, while all of LA County has been approved to move in this direction, Long Beach's numbers per 100,000 residents continues to trend lower than the county. Well, certainly higher than the state average, but as far as the county, we are doing better than our neighboring cities in the county as a whole. And those other indicators that are also positive for us. We hope that those indicators allow us to do this safely. And in addition to those reopenings, what happens now? What happens now is as we roll into the slow reopening, the future of what happens to Long Beach is now up to you. Either next week and into this weekend, we're going to be responsible. People are going to wear face coverings and masks when they go outside. They're going to wear them wherever they go to a location. They're going to take care of themselves. Or they're going to be irresponsible. There's going to be gatherings. We're going to pass the virus along, and we're going to burden our hospitals. And what that is going to do is going to stop our progress dead in its tracks. And if that happens and begins to happen next week, then all of the other small businesses that are counting on us to do the right thing will not be able to reopen. And the worst case scenario is we'll have to roll things back. And so if you are a small gym that was ready to reopen, if you are a nail technician that is ready to get back to work, your ability to do so will be completely dependent on how responsible the citizens and residents of Long Beach are in the weeks ahead. It is up to us how fast we reopen, because the metrics that we're watching for are clear. We know exactly what percents we're being asked for from the county and from the state to not go over in hospitalization rate, in our averages, in our medians. And so we need to, as we move forward, and we have seen some of our hospitalization rates tick up. I know that today's number, I think, is a little better than yesterday's, which is heartening. But overall, we have seen that slight tick up. We have to be responsible. If you want to support businesses, put on a face covering, put on a mask, and that's how you protect each other. Is sanitize your hands, wash your hands, put on a face covering. All the folks that are out there walking down tight sidewalks, not wearing face coverings, all you're doing is either rolling back what we've had, or you are denying the ability for our small gyms, our nail studios, our tattoo parlors, and all the other activities to get back to normal. That is what will stop us. So it is our decision as a community. Either we continue forward, or we're going to stop or roll back. And we're going to know in the next week how that data is looking. So please, I'm pleading with everyone to do the right thing. I want all of our restaurants that begin to open to succeed, but they're not going to be able to do so without your help. Let me also add on the topic of restaurants. Our Open Streets initiative is also, as you probably know, beginning this weekend, which we're really proud of and excited about. We have already the first parklets for our restaurants to expand onto the street are reopening this weekend. That includes a parklet in Bixby Knolls, adjacent to E.J. Malloy's, and there's also the alley right over there. In Belmont Shore, right by George's, over there between Glendora and Pomona. We're going to have a parklet there. We're going to have a parklet over in downtown on Pine, between 4th and 5th, over by Pie Bar and Romeo's Chocolate. And beginning this weekend, you'll see work start to also close the parts of the promenade to the restaurants that are all along the promenade for them to expand their restaurant space as well. This will give the ability for restaurants to be able to survive so that their capacity is larger. And these, of course, are just the first batch. We have a lot of restaurants that are interested, and we'll slowly begin to roll these out this weekend and going into next week and beyond, including residential streets as well that'll be selectively closed. And so we're proud of that. Thank you to everyone that supported that. And I look forward to seeing them in person as well, and safely in the weeks ahead. Now I want to transition to a couple other topics. First is testing. As I announced on Wednesday, Starting this weekend, Cabrillo High School will now test anyone that wants to test, whether you have symptoms or not. We know that testing is crucial, especially in this next phase where more folks are exposed, where there's greater risk of infection, there's greater risk of catching COVID-19, now more than ever, because there's more people out. And so Cabrillo High School in West Long Beach will now test anyone. So we encourage you, if you don't have a symptom, but you're going back to work, get a test. And it's free, whether you have insurance or not. We encourage that. And of course, if you have symptoms, you absolutely should get a test. And of course, be at home, self-quarantined, not at work. And please go get a test. We have 6 locations total across the city. Now I want to talk about a new program we're launching today, which is our Great Plates program. You know that we have our World Central Kitchen program, which has been pretty exciting, which has been delivering thousands and thousands of meals all across the city for seniors. And in fact, just today I saw the meal preparation program at the Ordinary in downtown Long Beach. They have done now almost 25,000 meals for seniors across the city of Long Beach. And today we're launching a second program called Great Plates Delivered. This program is providing nutritious meals for adults over 65 years that are at risk and that need our support. This has been a partnership with Governor Newsom, so thank you to the governor for his support on this program. And there's a variety of restaurants that are now going to be participating, providing meals delivered to seniors. This includes restaurants in every corner of the city, like 5,000 Pies, Bon Thai Restaurant, Egg Heaven Cafe, La Paisa Restaurant, Hamburger Mary's Long Beach, Michael's Pizzeria Downtown, O'Neill's Comfort Kitchen, Pier 76 Restoration, Starling Diner, Taboo Mediterranean, the 908, the Little Brass Cafe Express, La Guantaquita Restaurant, and Bebop Filipino Soul Food for starters. So all of those locations, thank you. They're going to be making meals for seniors, and we're looking forward to that. If you are a senior and you're thinking, how can I participate in this program? I'm low income, I need support. You go to the longbeach.gov website. There's a senior meal delivery section, or longbeach.gov/senior meal delivery, and you can sign up. Or you can call us at 570-INFO, which is 4636. 570-4636. It's on the COVID-19 website. And please, we want to help. And with that, I want to turn this over to Dr. Davis, who's going to give us more of an update. Thank you.
Thank you, Mayor Garcia. Good afternoon. So I'd like to address a couple of questions and issues that have come up as we've been testing and doing case investigations. So one of those is that sometimes we hear, so when you get your PCR test, which is you can get at one of our 6 drive-through or walk-up locations, or through our public health lab or other areas. So when you get one of those PCR tests, which is a nasal test or the oral test, and it comes out positive, then we will call you to do an interview. And sometimes what we've been hearing is, yes, we'll tell you your test was positive, and then like, oh, but we got an antibody test, and the antibody test was negative, so therefore this PCR test was a false positive, and I don't actually have COVID-19. This is what the people are telling us that we're talking to on the phone. So what I'd like to say is that the PCR test is positive, and the antibody or the serology test is what is falsely negative. So the PCR test is detecting the actual genetic material of the virus. And so it's really good at doing that, at least 95% accurate at being able to detect. So if you test positive, that means we're over 95% sure that you were actually infected with the virus. Unfortunately, right now, we can't say that for the antibody tests, which are a blood test. So usually, just to give some background, usually when you market a test, in order to be able to provide it to the public, you have to go through all these really rigid tests, and you kind of have to prove that it works with a certain percentage, so for a certain confidence. But with the serology test, because we were in a pandemic, the regulators, which were the FDA, decided not to skip that and just let these tests get out there. And so basically anybody, any company could market or release these tests without doing all of those studies beforehand to prove that, yes, it's accurate, we're 95% sure, we know how it performs. So you can have both false positives and false negatives because the tests haven't been studied or required to follow any regulations or prove their performance standards. The FDA is now looking at that. They're going back and trying to be a little bit more stringent, but right now we still can't say with any confidence how these tests perform. So you can have false positives because they're picking up antibodies that look like the COVID-19 antibodies but aren't. And you can also have false negatives because it can take 2 to 3 weeks after you're infected before you develop antibodies in your blood. Or it could just be that the test you're using just isn't that accurate and just doesn't pick up the antibodies well. So the bottom line is that right now we cannot use the antibody tests to diagnose anybody with COVID-19 infection or to guide your care in any way. We also can't use it to tell you whether you're immune to the infection or how long you could be immune to the infection. So we're only using the PCR tests right now to diagnose whether you've been infected. And so that is what we're also going to use to tell you if you need to isolate, is the PCR test. So if we call you and we tell you that your test is positive, that's what we're using. That does indicate that you're infected with COVID-19 at some point, and we're not going to use antibody tests to make any decisions about what you should do. So that's one thing. And then the other thing that I wanted to bring up is how to interpret and act upon tests that you get if you don't have symptoms or you're asymptomatic, now that we're expanding that testing to anyone who desires a test, whether you have symptoms or you don't have symptoms. So getting tested for COVID-19 when you don't have symptoms just adds another layer of challenges in interpretation. Like I said before, the test is very good at detecting the virus because it's detecting the DNA. So if the test is positive, we feel confident that you have been infected with the virus that causes COVID-19. However, this positive test does not tell us when you were infected or whether you're contagious. So once you're infected with COVID-19, it's been seen that you may have positive test results for several days or weeks afterwards, even though you're no longer contagious or even sick. So data indicates that infected individuals can spread the virus to others within the first 9 days of their illness. After that, you might still be positive, but the test is just picking up dead virus particles that won't cause infection in other people, and you no longer can transmit that infection to other people. But because you never had symptoms when you were tested, we can't really tell. It's unclear whether your positive test that you're getting now indicates this 9-day period, that you're in that 9-day period, the first 9 days of infection, when you can transmit the virus, or whether it's been longer than that, which means you're not contagious because you never had symptoms, so we're just not sure. So although it's unclear when your infection started, for the reasons I've stated, we public health officials are going to consider that positive test as a recent infection and a confirmed test, a confirmed case of COVID-19. And we will assume that you're contagious for the next 9 days, and we will proceed accordingly, whether you had symptoms or not. That question has come up that people, because they don't have symptoms when they test, the question is, do I still need to isolate? Can I go to work? And the answer is yes, you do need to isolate, and no, you cannot go to work. You need to isolate for 10 days. So you'll need to follow the public health emergency isolation order and self-isolate for 10 days and inform your close contacts that they may have been exposed to COVID-19 if they were around you from 48 hours before your positive test until the 10 days after. So if you take a test, so that's if you're positive. So if you're positive, you are a confirmed case, you have to isolate for 10 days. And you have to tell people who you were in close contact with that they need to quarantine. So if you take a test while you're asymptomatic and you receive a negative result, there's some challenges with interpreting that as well. So one challenge is that you could have taken the test during your incubation period. So the virus, when you become infected, it takes some time. The virus has to kind of grow inside of you for a while until it reaches the level where the test will be positive. And that's called the incubation period. And for COVID-19, that's between 2 and 14 days. So you may have been exposed to someone with COVID-19 on May 1st, for instance. You may have become infected, but it can take up to 14 days or May 15th for you to have a positive test. So if you're tested on May 3rd, for instance, you don't have symptoms, you knew you were exposed, so you decide to get tested. It could be that you're infected, but the virus hasn't reproduced enough to get to the level where the test is going to pick it up. And so you'll receive a false negative. So it's important that even though you get that negative, that you still continue your quarantine for the full 14 days after you were exposed. And so that means following the quarantine, the public health emergency quarantine order. Some essential infrastructure workers have a different protocol that they follow, so you need to talk to your supervisor about that. One other challenge with interpreting negative test results when you don't have symptoms is that it's only providing you information for the moment in time when you took the test. Because we know that COVID-19 is in the community, you're going to be continually possibly exposed to it as you go about your day, visiting retail establishments, working, et cetera, just as you go about in the community. So although the test that you took on that particular day was negative, it's still really important to be vigilant with physical distancing, facial coverings, hand hygiene, respiratory etiquette, covering your cough, and staying home when sick, because each day presents an opportunity to be exposed to somebody with the virus. Thank you.
Thank you, Dr. Davis. We're going to go ahead and go to our questions. And after that, we're going to have, of course, our Spanish translation from Teresa Ayala Castillo. And of course, Paola is always with us doing our ASL translation. But we'll take any questions from the media.
Okay, first up, we have Valerie from the Post. Valerie? Valerie, are you there? All right, we'll come back to Valerie. How about Haley from Southern California News Group?
Can you hear me?
Yes.
Hi. Okay, so my question is just about the reopenings of restaurants, hair salons, barbershops. Can you just expand a little bit more on what that will look like in terms of capacity? I've heard from some people who are a little confused about, what it means to wear a mask while you're eating inside somewhere. So can you just explain a little bit more of what that will look like?
I don't think it's been finalized yet.
I think Dr. Davis, do you want to touch on that?
Yes, so it hasn't been finalized yet. There will be, so I can give you some general ideas. There will be decreased capacity. I don't know to what level. Physical distancing will be very important, and there'll be a variety of ways, including a decreased number of tables that you're seating, partitions. For hair salons and barbershops, there'll be a lot around limiting people waiting in the lobby or waiting to get their hair cut. They might ask them to wait in their car. Face coverings, of course, that will be important. Symptom checks, hand hygiene, making sure that's available, doing it on a regular basis. Personal protective equipment for workers, especially in hair salons and barbershops. disinfection and cleaning in both of those establishments, making sure just all the kind of stuff that you would do in general. So making sure like your HVAC system is working well and they're having good circulation, doing as much as you can remotely, contactless payment systems, things like that.
And I think that the health order itself is not out yet because I think the final kind of finishing touches are being put on it as we speak, and it'll have all of the details. Some other kind of broad kind of rules that'll be in there. For example, the capacity limit certainly will be definitely reduced, of course, in these locations, like it was for retail when it was announced. Restaurants, there's going to be requirements, of course, because obviously individuals that are eating can't always have a face covering on because they're at a table. The requirements for those in the restaurant that are serving and interacting with the customer will have both a face covering component, but also there are some face shield components from what I understand that will be in there. So please look out if you're a restaurant owner. I know it's difficult to be able to say you're going to be able to open but not have all the rules. We wanted to share everything with you as much as we knew as of this moment, knowing that the details of that will be coming out tonight. And so I want to make sure that people understand that. The contactless system for payments, for menus and to essentially be disposable. And of course, the focus on trying to go outside is really key. And the one thing that's going to be really important for restaurants, for barbershops, is we know that if a customer does not feel safe in your establishment, they're likely not to return. And so it's up to the small business owner to be as safe as possible and provide that safety. We are making choices every day, you are, I am, about where to pick up to-go food based on how safe we feel that location is. And I think that for all of us, the safer, and which is why I think you're not going to see, all the restaurants in Long Beach open tonight. This is not what's going to happen. You're going to see a slow rollout. And that's because they have to prepare and because they know that when they reopen, it has to be done safely. And if the customers don't feel it's safe, there's a possibility of losing that business permanently. And I think the same goes for barbershops and for places that provide haircuts. And so that's, I think, all part of this. Again, we think that within the next couple hours, all those details will be up.
We're going to try Valerie again. Valerie, are you there?
Hey, I'm here. Cool. You can hear me, right?
Yes.
Yes.
Okay. Okay, so hospitalizations were supposed to be like the one data point that was a reliable real-time marker, but according to the city's dashboard, the actual number has been varying a lot from the reported number in the last month. Are the hospitalizations still a big concern for you as we open up, and at what point will the hospitals be overwhelmed?
Well, we can want to both answer that. You want to go first? Or go?
Sure. So right now, we still have good hospital capacity. So that's good, and we'll be monitoring that on a daily basis. The trend of increasing hospitalizations is concerning. We haven't seen a big spike, so that's good. But we are following closely that there has been kind of a steady, trend going upward.
And I'll add to the thing we've learned throughout the last couple of months is, unfortunately, the most accurate data that we get is not the one that we look at in the moment, but after we get kind of the reporting back from the hospitals. And sometimes it takes days or weeks to get exactly the accurate reports from what they look like. And so it's both looking at the snapshot of the day, but it's also going backwards and seeing kind of how some of those numbers end up flattening out once the actual real hospitalization number is put in, because we know these are the hospitals don't give us exactly real-time information all the time, and so it is a constant inputting of data that is happening at the health department. And I'll just reiterate what Dr. Davis said. It is concerning. Hospitalizations is what we should be looking at. I know that our health department director, Kelly, is, there is a formula, which is this 5%, I think it's over 7 days formula.
Average increase.
That is what we'll look at, which is then when you go beyond that is when that's really becomes a more serious problem. But we shouldn't be surprised also that when more people are exposed and are doing activities that are riskier, that you're going to have other challenges on the medical side. And I think that's why knowing what's going to happen here in the future and trying to find this balance between the suffering and devastation of almost a quarter of your city that is not working, unemployed, when our unemployment rate was at about 5%, 4.5%, 4.6%, and now we're between 20 and 25%. And the most important measure, which is human life and public health, which is always the most important, and how you move forward with those as guiding our process is really hard. But we'll continue to watch it as we go forward.
Next up, we have Rachel Jordan from ABC News.
Hey, can you hear me?
Yes.
Okay. So this question is for the mayor. Last Friday, you had mentioned making announcements regarding car parades and drive-up dining service. I was wondering if you had made any decisions about either of those two, or if the city would be aligning with the county.
I think that some of that is in the order that will be out today, right?
So I think that the specifics of those activities are going to be in the order as it's released today. We are going to allow to have, listen, some of these car parades are already happening. I think we see them across the city, and they're family friendly, and but we want to create a process, obviously, that's safe. We have a lot of inquiries about how to do it safe. So those should be in the order today, or there should be guidance out on that. So those will be official. And as far as drive up, that's something the city's been working on as well. I believe, Dr. Davis, will that be in the order today?
Yes, I believe so.
Okay, so that should be in the order today as well.
Okay. Next up is Kelly from Long Beach Post.
Yes, hi. Wanted to ask about enforcement. Is the city going to be inspecting any businesses before they reopen? And also, are we going to be doing random inspections to make sure businesses are in compliance, or is it going to be more of a case basis where if a business is being reported, then we'll go out and inspect?
Well,
How's that going to work?
Yeah, I just got literally a report on this. So I do know that we have a strengthened code enforcement team starting this weekend, specifically because we have so many more businesses that are going to reopen. So they're kind of all of our officers and then some are going to be out, I think, from what I understand, from a code enforcement perspective, to ensure that our restaurants and businesses and places are complying. If a place is not complying, we need to know about it, because that means that they are going to make it worse for everybody else. And people should be calling in the 570-4BIZ line, 570-4BIZ. We have live people that answer the phone every day, but if it's after hours or there's no one there, leave a message and we get those really quickly. But yeah, we will have code enforcement and folks out this weekend. I'm not sure if they're random or how those work. A lot of them are driven by complaints. Some might be random, or some might be hotspot locations that we've had. People have called in before. Is that what?
Yeah.
So I think that's a plan for now.
Next, we have Margaret Carrero from KNX Radio. Margaret, are you there? Well, looks like we may have
Maybe if
lost.
Margaret's there, she can send us her.
Yeah, we'll check. We have a couple of questions from social media as well. One person wanted to know, is there a possibility of a second wave?
Yes, there's always a possibility. As we, because we don't have a way to treat this yet, we don't have a vaccine, really the driving force is people who are coming into contact with each other. And so as that continues to increase, as we're out and about, that's what's going to drive our increases. So it's very important to really do that very carefully, to really be careful with who you're around, stay home when you're sick, don't be around other people when they're sick, explore teleworking. Hand hygiene is really important. All of those things are really important. Wearing your face covering and just being really careful now that you can go out and all these places are open. Doesn't, still be careful about how you go out and how you behave and how you interact with the environment. It really can't be the same way that it used to be, or we will see a second wave.
Yeah, it's completely possible, and it's completely up to us whether there's a second wave or not, and our behavior over the next few weeks. And remember that if there is, that will lead. Right now, our hospitals are between 50 and 60% capacity. So I think it depends on on the day. But if that number, that 50 to 60%, it starts going closer to 70, 80%. And our hospitalization rate is spiking up. No one at that point should complain about we want more to reopen, because more is not going to reopen. At that point, we're stopping immediately, or we're going backwards. And that's not just going to happen in Long Beach. I think the governor mentioned that even today, statewide, the possibility of having to go backwards or pausing. And so again, if you want your fitness studio to open up, your yoga studio, your nail place, we put on a face covering and a mask and wash your hands constantly and try to stay home when you can.
Margaret was able to send her question in. She wants to know if there's going to be any enforcement in regards to face coverings.
So that one's hard. I mean, no one wants to give someone an expensive ticket because you're not wearing a face covering. But the truth is that the health order essentially requires us to wear a face covering if you're outside around other people. And I get that there's a lot of other kind of small exceptions. Obviously, if a small child or if you're walking alone in a neighborhood, sure. But let's not focus on the exceptions, because those are also confusing in my opinion. But on the general rule, if you're going outside your home, put on a face covering or a mask if you're going to be around other people. Certainly, if you're going to go in any sort of business, you have to wear one. And so, yes, police and others are out there reminding folks, but they're trying to be educational. And I'll be honest, most people are doing the right thing. And there are occasions where we have folks in our community that are defiantly not wearing a face covering because they think, I don't know really what they think, but I've heard from some that they feel it's a sign of weakness, or it's against their freedoms, which is completely BS. And I think wearing your face covering, wearing a mask is a sign of strength, and is a sign that you actually care about other people, and it's a sign that you care about the most vulnerable in our community. And so when I'm out and I'm driving around and I'm seeing groups of folks not wearing their face coverings out and interacting with other people, to me, that is selfish. And I hope that we can all do a little better than that.
Dr. Davis, question regarding assisted living facilities. When will they be open to visitors, and is there any other update?
So there's been a lot of discussion about visitation. We know that it's very heartbreaking right now to not be able to visit your loved ones and your family. My mother-in-law is in a skilled nursing facility, and I don't think my father-in-law has been able to see her for several months, and he came every single day and stayed hours and hours. So I can feel the stress that it has on loved ones. So there have been a lot of discussions. A lot of the restrictions are coming from the federal government, the Centers for Medicaid and Medicare, called CMS, and they've actually recently, to my understanding, has extended the restrictions on visitors. But I think there's been a lot of discussions about trying to identify those times when having a visitor would be really beneficial. Besides end of life. Right now, at the end of life, you are able to have a visitor, but we're trying to identify other times when that could be helpful, and then just how to do it in the best way possible. There've been some discussions about like testing before you go in to visit, becoming a caregiver. So there's a lot of things. So we don't have specifics right now, but we understand that this has been going on for quite some time and that it's really hard for families. So there's a lot of discussion at the state level and the local level to see what we can do about that.
All right, our next question is for Mayor Garcia. Any update on youth sports?
No update on youth sports. That's a very, very complex question. We would love to do it in a way that's safe, including our Parks and Rec programs. But, and I think that the health department team and quite frankly, the state, the California Department of Public Health is supposed to be putting out some guidance around youth sports and summer, which is why everyone's kind of waiting because they are working on a kind of a statewide approach that we would then have to follow. And so it's not helpful for us to put something out that will be superseded by the state's order. So we are trying to figure out what we do there, but it won't look like it did last summer. So whatever it is will be different. And this we keep hearing the state guidelines on it are coming out in the next days, week or so. So that's what we're hoping happens.
Dr. Davis, can you clarify the definition of exposure?
Yes, so exposure means, so in the context of COVID-19, it means that you were like exposed to the virus. So you had a contact with somebody who was contagious with COVID-19. So either you were in a meeting with them and you were sitting closer than 6 feet, you live with them, that will expose you to the virus. So it just means that you were close enough to somebody that you could have become infected from them. So you were exposed to the virus. You were close enough that somebody could have transmitted it to you. And then sometimes what we can do is we'll categorize the exposure. So we'll say it was a high-risk exposure, meaning that somebody you live with or somebody you're intimate with, those are high-risk exposures. Close contacts, it might be like a medium-risk exposure, somebody you were at a meeting with or somebody you work with. And a low-risk exposure might be somebody that you guys work together, but you're not around each other very often, and maybe you pass them in the hallway or something like that. Face coverings, wearing your face covering as a source control does lower the risk of exposure. We don't know to what level, but that's one of the reasons why it's really important, because if you're by somebody but you're wearing your face covering, your droplets aren't going to get out as much and be as likely to transmit to that other person. And so the risk of exposure is lower.
Great. Well, thank you. I'm going to go ahead and now turn this over to Teresa for our Spanish recap. Thank you.
Muchas gracias, alcalde García y doctora Davis. Buenas tardes. Hoy es nuestra sesión informativa para el 29 de mayo. Comenzamos con una actualización de nuestros últimos números. A partir de hoy, ahora tenemos 1,850 residentes que tienen pruebas positivas de COVID-19. Aproximadamente 1,266 personas se han recuperado. Y lamentablemente nos entristece informar que hemos perdido 4 más residentes de Long Beach desde ayer. Eso eleva el total de muertos por COVID-19 en Long Beach a 85. 66 son asociados con centros de atención de largo plazo. El condado de Los Ángeles recibió la aprobación del estado hace solo unas horas para reabrir restaurantes para comida y personas y los servicios en peluquerías y salones de belleza. Al principio de esta semana anunciamos que Long Beach se había asociado con el condado de Los Ángeles y la ciudad de Pasadena para solicitar una variación o vía rápida para poder hacer esto posible, basado a nuestros indicadores de salud que han cumplido los requisitos que nos permiten hacer estas reaperturas posibles. Ahora que hemos recibido la aprobación de hoy, la ciudad está trabajando rápidamente para poder proporcionar pautas a estas empresas para garantizar que los empleados y clientes estén protegidos. Los datos de salud continúan mostrando que los números de Long Beach por cada 100,000 habitantes, aunque ligeramente más altos que el promedio estatal, son más bajos que en otras áreas urbanas densas. Esto y otros indicadores positivos continuarán impulsando las decisiones de reapertura y los plazos de los funcionarios de la ciudad. La nueva orden de salud de la ciudad, junto con estos protocolos y pautas para las empresas, estarán disponibles en el sitio web de la ciudad más tarde, el www.longbeach.gov/COVID-19. Quiero recordarles que todavía estamos en una crisis de salud. En cualquier momento, este progreso puede detenerse o puede tener que retroceder. Pero hoy podemos ver estas reaperturas adicionales porque Long Beach ha sido responsable y debemos seguir los protocolos y pautas de seguridad para mantenernos en este camino positivo. Por favor, sean responsables, usen coberturas de máscara y tengan mucho cuidado cuando salgan. Tenemos una actualización realmente importante para proporcionar con respecto a las pruebas en nuestra ciudad. Hemos estado trabajando durante las últimas semanas para aumentar las pruebas de COVID-19. Sabemos que las pruebas son una herramienta crítica para ayudar a encontrar y aislar casos. A partir de mañana, nuestra capacidad de evaluación continuará creciendo, ya que las pruebas gratuitas ahora estarán disponibles en el sitio de la Escuela Secundaria Cabrillo. Para todos los residentes si tienen síntomas o no tienen síntomas. Anteriormente, solo aquellos que tenían síntomas y trabajadores esenciales que no tenían síntomas podían hacerse la prueba en estas pruebas sitios de la ciudad. Comenzando mañana, las pruebas ampliadas están disponibles para aquellos que sospechan o están preocupados que tienen COVID-19. También tenemos 5 sitios de pruebas adicionales en toda la ciudad disponibles para aquellos que exhiben síntomas y personas mayores de 65 años o que tienen condiciones de salud crónica. La información de estos sitios también se puede encontrar en el sitio web de la ciudad. Tenemos más noticias importantes que ofrecerles a medida que avanzamos el fin de semana y continuamos abriendo nuestra economía. Hemos escuchado a nuestros negocios locales y entendemos sus dificultades y hemos estado explorando formas nuevas y seguras de apoyarles durante esta pandemia. Como resultado, avanzamos con el programa Open Streets o Calles Abiertas a partir de hoy. Este programa nos permitirá abrir más espacios públicos para actividad en el aire libre, acceso de tránsito y actividades económicas con distanciamiento físico seguro. Los primeros espacios de calles temporales se abrirán en las siguientes áreas: Bixby Knolls entre Atlantic Avenue y Burling Hall Drive, Belmont Shore en la calle Segunda entre Glendora Avenue y Pomona Avenue, Downtown en el calle Pine entre la Cuarta y Quinta. Ubicaciones adicionales en toda la ciudad durante las próximas semanas van a ser expuestas. Quiero agradecer a todos nuestros dueños de negocios por sus inversiones en Long Beach. Ustedes brindan valiosos servicios a nuestra comunidad, especialmente durante este momento tan difícil. Uno de los problemas críticos que hemos enfrentado desde el comienzo de esta emergencia es que muchos de nuestros residentes mayores no tienen lugares de ir a comer. Algunas personas han tenido dificultades para obtener lo esencial como las comidas o esta actividad riesgosa mayores debido a una aflicción de salud. Hoy nos orgullece anunciar el lanzamiento de Great Plates Delivered. Este increíble programa proporciona hasta 3 comidas nutritivas gratuitas entregadas diariamente a adultos clasificados mayores de 65 años y a ellos con riesgo. Los proveedores locales de alimento han sido seleccionados en un proceso de solicitud. Los restaurantes participantes incluyen 5,000 Pies, Bajan Thai Restaurant, Bebo Filipino Soul Food, Egg Heaven, El Paisa Restaurante, Hamburger Mary's y La Guayanquita, y muchos más. Para una lista completa de restaurantes o para más información, si usted esté interesado en este programa, por favor visite el sitio de longbeacheach.gov /COVID-19 o llame al 562-570-4636. Hemos escuchado que las personas se han realizado una prueba de PCR de COVID-19, ya sea de nariz o prueba oral en nuestro disco en lugares o en otro sitio y dieron positivo. Luego hacen una prueba de anticuerpos y es negativa, por lo que creen que la prueba de PCR debe haber sido un falso positivo. La prueba de anticuerpos fue un falso negativo. La prueba de PCR está detectando el material genético del virus. Es realmente bueno para hacerlo, más del 95%. Entonces, si su resultado es positivo, es 95% probable que haya sido infectado con el virus. No podemos decir eso sobre las pruebas de anticuerpos. Por lo general, antes de poder comenzar una prueba, debe demostrar que funciona con un cierto porcentaje de confianza. Tienes que demostrar que la prueba funciona, pero con las pruebas de serología o de anticuerpos, el FDA decidió omitir este proceso y permitió que cualquiera que quisiera comenzar a realizar estas pruebas lo haga. La conclusión es que en este momento no podemos usar pruebas de anticuerpos para diagnosticar la infección de COVID-19. Solo usamos PCR en este momento para diagnosticar si usted ha sido infectado. Solo usaremos una prueba de PCR para decirle que necesita aislarse. Hacerse la prueba de COVID-19 cuando no tiene síntomas agrega algunos desafíos para interpretar los resultados. La prueba es muy buena para detectar el virus porque está buscando su ADN. Entonces, si la prueba es positiva, estamos seguros de que usted ha sido infectado con el coronavirus, el virus que causa COVID-19. Sin embargo, esta prueba positiva no nos dice cuándo estuvo infectado y si es contagioso. Una vez infectado con COVID-19, se ha observado que puede tener resultados positivos durante varios días o semanas después de haberse infectado, a pesar de que ya no esté contagioso o enfermo. Los datos indican que las personas infectadas pueden transmitir el virus a otras personas dentro de los primeros 9 días de su enfermedad. Después de eso, puede ser positivo por la prueba de detectar particulares del virus muertas que no causan infección en usted o en otras personas. Debido a que nunca tuvo síntomas, no está claro si su prueba positiva fue dentro de las primeras 9 días de la infección, lo que significa que es contagioso, o si fue más largo que eso, lo que significa que no es contagioso. Aunque no está claro por las razones indicadas, los funcionarios de salud pública tratarán esta prueba positiva como una infección reciente en un caso confirmado de COVID-19 y asumir que es contagioso. Debería cumplir con las órdenes de aislamiento de emergencia de salud pública y autoaislarse durante 10 días e informar a sus contactos cercanos que pueden haber estado expuestos a COVID-19 si estuvieron cerca de ustedes desde 48 horas antes de tomar su prueba hasta que comience el aislamiento. Si realiza una prueba mientras estaban sin síntomas y recibió un resultado negativo, también existen problemas para interpretarlo. Un problema es que podía haber realizado la prueba durante su periodo de incubación. El virus tiene que reproducirse y crecer en su cuerpo hasta que alcance un nivel que pueda ser detectado por la prueba. Eso se llama un periodo de incubación. Es posible que haya estado expuesto a una persona con COVID-19 el 1 de mayo, por ejemplo. Usted puede infectarse, pero puede tomar hasta 14 días o hasta el 15 de mayo para que tenga su resultado positivo. Entonces, si te haces una prueba el 3 de mayo, por ejemplo, podría ser que los estables en el nivel en el que prueba positiva no existan y puedes recibir un negativo falso. Por lo tanto, si sabe que estuvo expuesto a alguien que tiene COVID-19, es importante que siga las precauciones durante los 14 días después de su exposición. Esto puede significar seguir las órdenes de cuarentena de emergencia de salud pública, aunque algunos trabajadores esenciales sigan diferentes protocolos. Hable con su supervisor para ver si pertenece usted a esta categoría. Otro problema con la interpretación de las pruebas negativas cuando no tiene síntomas es que solo proporcionan información para ese momento. Debido a que sabemos que el COVID-19 está en la comunidad, usted estaría continuamente expuesto a medida que avance su día, visitando negocios, trabajando, etc. Aunque la prueba fue negativa ese día, todavía es importante estar en alerta con distanciamiento físico y coberturas faciales, lavarse las manos y quedarse en casa mientras esté enfermo, porque cada día presenta una oportunidad de exponerse al virus. Muchísimas gracias.
Gracias. And I just finally, I do want to clarify, as we were getting the translation, I got additional clarity on the bars piece, because I think this is really important just to make sure, and so the state guidance with what we're getting right now is essentially, obviously, restaurants in dining rooms can open. If a bar has a kitchen and been approved by the health department, bars can open up the restaurant portions of their establishment. So if there are booths, if there are tables, and they actually serve and they're serving food, those locations can be open. The bars themselves, so a bar that you would sit at on a stool or bars, those are not allowed to open. And so if a bar has both, where you have an actual bar and you actually have a dining room or an eating area, the eating area with proper distancing and requirements as it relate to occupancy can reopen. The bar area cannot. And as a reminder, this is for everything, there's also no kind of standing around that is allowed in restaurants or bars. You have to essentially be sat at a table. And so again, if you're thinking about a bar environment, there is no activity at the bar. There is no standing around the bar that's allowed. Just people sitting at the table using the distancing and the occupancy requirements. And the same goes for restaurants if they have a bar as well. So just clarity, and that will all be in the order that will be going up, I understand, in the next hour or two. So thank you very much.